I want to welcome everyone to the CMSA Foundation Award Program, where we recognize our fellow colleagues for their tireless efforts in case management practice improvement and case management research. This recognition and awards would not be possible without the unwavering support from our chapters, case managers, and friends of the Foundation. Over the last couple of years, many of you in this room have given donation, purchased raffle tickets, counted jelly beans, purchased products, and had your photo taken in our booth with a Vegas star. While the Foundation is a separate entity, we are connected through CMSA leadership with 4 of the Foundation board members serving dual roles on the CMSA Board of Directors. The Foundation has always supported these awards, but through recent restructuring, it is with pride that we are able to accept management of these 2 awards in 2018. The Foundation is now responsible for award oversight, including reviewing, developing the guidelines and submissions, scoring criteria, and supporting a dedicated awards committee. This year's awards committee was comprised of Mary McLaughlin Davis, Susie Rattery, and Linda Hobkirk. Their review and recommendations were vetted and verified by the full board. The committee and board gave numerous hours of their time to read, review, and score each submission independently in order to make a final decision. Originally established in 2011, CMSA began awarding the Case Management Practice Improvement Award and Case Management Research Award to recognize an individual, group, or organization that demonstrates outcome from a project using innovation to advance the practice of case management, improve client outcomes through research, or process quality and performance improvement. In 2018, the CMSA Foundation became the sole sponsor of these awards. These 2 awards have been established to honor successful efforts to promote evidence-based case management practice, acknowledge exceptional efforts to research best practice innovations that help quantify and define outcomes in case management, encourage activities which aim to advance knowledge of case management, and recognize efforts that promote essential practice components as defined by the CMSA Standards of Practice. The Foundation uses your generous donations to fund these awards. Each recipient is awarded a $1,500 honorarium and a plaque to commemorate their efforts. Later this year, each award recipient will also be given the opportunity to submit an article to the CMSA Today magazine. I would like to thank each of the individuals and organizations who took time to complete and submit entries reflecting their commitment to case management research and practice improvement. This year, I am very excited to tell you that a record interest of 9 entries was submitted this year for these 2 awards. As you can see, there were some great entries this year. Now let's meet our 2019 recipients. The recipient of the 2019 Case Management Practice Improvement Award goes to Pathway Home, by Coordinated Behavioral Care. Accepting the award is Barry Granick, Senior Director for the Pathway Homes program.
Thank you, Deborah. This is really exciting. I'm also really nervous, so please bear with me. It's an incredible honor for CBC's Pathway Home program to be recognized by the Case Management Society of American Foundation and by the Foundation Board of Directors as the recipient of the 2019 Case Management Practice Award. To be in a room full of case managers and people who have dedicated their lives to improving healthcare is not only an honor, but a privilege. I'm sure we can all agree that a nice extended weekend in Vegas has been well earned. Hopefully everyone is able to make some time and celebrate your hard work. Individuals who undergo extended stays in psychiatric hospitals or other institutional settings face enormous challenges 5 years ago, we set out to transform the way New Yorkers with serious mental illnesses transition from institutional care to the community. CBC implemented an innovative initiative to improve the quality of services provided during such care transitions. Pathway Home set out to improve the process of reintegrating individuals back into their communities after these extended hospital stays by utilizing multidisciplinary teams, providing intensive services beginning shortly before hospital discharge and continuing through a series of 3 phases for 6 to 9 months. Teams address a host of issues faced by participants during their transition, including housing, food, economic security, medication, linkages with outpatient providers, family and social isolation. By providing a different form of intensive support, individuals are able to return to the community and remain there. On behalf of Coordinated Behavioral Care and Pathway Home programs, I would like to thank the Case Management Society of America Foundation for this Case Management Practice Award. It is important to thank the New York State Office of Mental Health, Commissioner Sullivan, and the local field office, headed by Bob Moon, for championing our program and for the ongoing support. A special thank you to all our frontline staff and the daily dedication of the care management agencies who run our teams who make transformation happen. And lastly, I would like to acknowledge the amazing work that everyone here at this conference does each and every day. Thank you.
The recipient for the 2019 Case Management Research Award goes to Kelson Zaire for his project entitled The Case Study, Triad Case Management Model Applying Human Performance Technology.
Thank you. That'd be great.
Good afternoon, everyone. I would like to thank the Judging Committee and the Case Management Society of America Foundation for this award, specifically Rebecca Perez, Mayor McLaughlin Davis, Regina Wilson, Crystal Amos, and Michelle Lee for their extra time and efforts with my numerous questions. I would also like to congratulate all who participated and the CMSA members and case managers across the country for what you do. It only takes one. I'm sure most, if all of us have not heard before, treat patients as if they are a family member to give them the best possible care. First, as a patient, I was involved in a very bad car accident when I was age 17. The car rolled 2.5 times and was on my arm, and they had to use the jaws of life to get me out. If it were not for helpful citizens and case managers, I may not be opportunity to have you be here. It only takes one. Then, as a family member, working with case managers, doctors, and other healthcare professionals to care for my mother, who had Parkinson's disease, spinal cord injury, partial paralysis, and numerous ongoing other healthcare issues in her catastrophic case management and hospice needs. It only takes one. Next, as a provider of on-site consulting here at Las Vegas, for the mass shooting, I had the opportunity to help out first responders, healthcare professionals, and case managers and victims deal with the aftermath of how it affected them. Finally, I didn't realize until after I was notified of winning this prestigious award that it directly aligned with my mother's passing final 2 wishes. One of them was to finish school. After my first 2 dissertation sites falling through, and needing to contact 1,300 hospitals to find one to complete my schooling, you will never know how much I truly appreciate this award in all ways: a patient, a family member, a case manager, and student. It only takes one. It ironically is only fitting that I would have the opportunity also to receive this award in Las Vegas, the biggest honor yet to date for me to serve and give back to those who have helped me in all ways of my life. My mother's other final wish was to find a girl. which may be beyond the scope of the CMSA. But then again, they have touched me in my heart and spirit in all ways. It only takes one. It only takes one case manager to be life-changing, to save your life, to care for your loved one, and to complete your PhD, and to give hope. To everyone out there, never forget how much you mean to the people you provide services for and each other. There is nothing more meaningful in life than to serve and care for other human beings in their time of need. Make sure each day that you thank yourself for the great things you do that are often unnoticed by others. They are never unnoticed by loved ones somewhere over the rainbow. Thank you.